if I get in the shoes of the other person, for instance, my mother, my boss, etc., I think it can be very eye-opening, but it requires a few minutes to really get in the shoes of the other person.
I would say it allows the client to feel in the skin of another person. Like when I offer a client to be their partner, and I would play the role of the client, for example, and I offer some sentences and some feedback and allows them to respond to me as their partner. It allows them to really feel what their partner feels in the communication. So it allows to feel in another person's shoes and not just to analyze or to realize, but actually feel as senses and how another person might experience the communication with them.
In training, role-playing, when therapists get in the shoes of their clients, it's very useful for training, for supervision. When therapists role-play a certain client and we role-play like a therapy situation, I don't think that's so good because I try to use real situations. So, psychology students, I prefer for him or her to work with what is happening to her right now instead of, okay, imagine that you are a patient and talk about your problems, and so the therapist can pretend to do an intervention. I think it's better to do a real intervention. Role-playing, like practicing something, I think it still has some use, but I would say it's a secondary intervention, like a more cognitive behavioral intervention that we could also integrate, but I think it's better and it suits better with the Gestalt therapy to work with what is really happening, not pretending, okay, let's rehearse how would you like to respond, like that kind of role-playing. It's better, okay, so this happens, what is going on inside you? And to follow the figure and try to complete the contact cycle. So I think that's better than the rehearsal of behaviors.